So where I would predict, there's two key areas. It's going to be combos, so it's going to be approaches that activate the immune system and that also prevent the immunosuppression. So you've got to have at least those two things going on. Immune activation, targeting, trafficking to the tumor microenvironment, combined with something that controls the immunosuppression. So as we move forward, we're going to hit more and more patients and impact their lives by actually looking at combinatorial strategies. So that is really where we're running to as far as an area of preclinical development, looking at how we can really optimize these types of therapeutic strategies for the vast majority of our patients. I think the second area that is really going to be compelling and very interesting is we right now don't really understand when we look at MRIs or CT scans of these patients that receive these immunotherapies if their tumor is back or if this is an immune response. Can you imagine the anxiety that a poor patient feels when their doctor comes in and says, there's an increase on the scan, but we don't know what's going on. We'll have to re-image you. It's very anxious. It's very difficult for patients to sort of receive this news as far as we don't know what's happening. So I think an area that should be emerging, and you're going to start seeing more and more data coming out in the next couple of years, is inflammatory imaging to help make that distinction. Is this an inflammatory response or is your tumor coming back? I think it's also going to be really helpful to inform how we actually design our combinations, dose and schedule, putting these two things together. And I think it's also going to give us an early indication of who is actually benefiting from our immunotherapies. But this is something that is not explored. This is something that's just beginning to emerge as even a potential area of investigation, but very important, not just for brain cancer, but for even melanoma, lung cancer, pancreatic cancers, any type of cancer that's going to use an immunotherapy where this can be confused.